I'm Suzanne Goshorn, and I'm a physical therapy assistant that's been here at Murchu Medical Center Rehab Department for 14 years.
And I'm Charla Rao. I'm an occupational therapist, and I have been here at Murchu Medical Center for 7, going on 8 years. We provide physical and occupational therapy services to people in our community. One of the programs we have developed in our department is lymphedema therapy. We have 4 therapists who are especially trained and certified in treating lymphedema. And today we'd like to share with you a little bit about our program. First of all, what is lymphedema? Lymphedema is an excessive swelling of a body part. It is most commonly seen in an arm or a leg, but it can be found anywhere in the body. There are 2 types of lymphedema. There's a primary lymphedema and a secondary lymphedema. If you see the picture of the lymphatic system, it basically shows we have fatty tissue, which is the lymph nodes, the lymphatic vessels, and then lymph fluid that runs through these vessels. So in primary lymphedema, there is usually a genetic link that causes the lymphedema. A person is born with less lymph nodes than the average, and because of this, the lymph nodes do not work as well as they should, and eventually this can lead to increased swelling over time. Another reason for lymphedema is obesity. People that are very heavy tend to have extra pressure on their lymph nodes, especially in the groin region. And because of this, the fluid does not flow as it's supposed to, and again, over time, they can have swelling. Now, in secondary lymphedema, there is a secondary reason or cause for the lymphedema. This is often seen with patients who are undergoing cancer rehab. They may have had lymph node removal or radiation, and because of this, the lymphatic system does not work like it should. And these people know why they have the lymphedema, but they really don't understand the process or the treatment, and that is where we come in.
So how does therapy help patients with lymphedema? The primary goal is to help reduce the size of the extremity. And by reducing the size of the extremity, you restore function of that limb by improved range of motion that they gain after reduction. There are psychological benefits by the reduction of the size of that limb. The patient feels better about their appearance. Also, because of the reduction in the size of the limb, they are able to complete self-cares more easily, to perform just normal daily activities with greater ease. There's also issues that can be reduced, such as the possibility of infection. When you have a lot of swelling in the extremity, you are more prone to infections such as cellulitis. So as we work on reduction of the fluid in that extremity, they are less prone to infections.
So now that we've told you about what lymphedema is and how therapy can help, the next part is telling you exactly what the lymphedema therapy treatment consists of. So really there are 4 main parts. There's a manual lymphatic drainage, there's wrapping with short stretch compression bandages, there's education and skincare, and then there's exercise. So first of all, with the manual lymphatic drainage, a lot of people consider this to be a massage technique, but really it's not a massage. What the therapist is doing is trying to move the fluid from a damaged area of the body to a healthy area of the body so that the fluid can be removed from the body altogether. Usually the manual lymphatic drainage part is very relaxing to a person, and it takes up the majority of the treatment session.
The next part of the therapy treatment is the wrapping. And basically what this is a series of up to 8 wraps that we put on. And these are bandages that are of low stretch, and they apply compression to help keep the limb from filling up with fluid when you're away from therapy. These are applied and kept on for a few days until your next treatment session. And so it is definitely a big commitment for that patient to do this portion of the treatment, but it is extremely helpful. Once we get the limb to the size that we would like to keep them at and maintain, and we are able to order compression garments that are much less cumbersome to wear, and they can be taken off at night, and it's much easier to bathe and shower once we get to that portion of our treatment.
Another big part of our treatment session includes skincare and education. Once a person has lymphedema, they will always have lymphedema. There is no cure for it. Instead, we have to teach a person to manage their condition, and that's where the education piece comes in. We teach people about skincare, about diet and nutrition, and just overall things they need to be watching for, and trying to protect their limb the best we can to prevent further complications.
The last part of the therapy is exercises. And exercises are completed with your compression garments on, basically to provide that compression while the muscle is pumping to help pump fluid out of the extremity. And these would be done on a daily basis. Lymphedema is a condition that cannot be cured, but with proper treatment can be well managed. If you or someone you know has lymphedema, please feel free to contact your physician. All we need is a physician's order for therapy, and we can be contacted at 712-755-4342 with any questions.